On Newsmax TV, I'm John Bachman, Francesca Page right here to my left, screen right. Little throwback to JB right there. He likes to say that a lot. We're moving on here with the program, and Francesca, we're going to talk about some health news. Looking back at 2014, a lot of very important health stories this year, and also some medical advancements.
That's right, John. And the latest scare involves the CDC. Federal health officials are currently investigating the mishandling of the Ebola virus at the Atlanta CDC. According to the CDC, it says the technician may have come in contact with a small amount of live virus that was part of an experiment. A lab tech is under observation as some believe he may have been exposed to the virus. But this is not the first time the CDC has mishandled viruses. Just a few months ago, samples of anthrax and the flu were mishandled, raising the question, what happens now?
Yeah, and this was really a lot of the concern at the onset of what took place when we found out the CDC was going to be so directly involved with the study of the Ebola virus. And joining us now to talk about this a little bit more is Nick Tate, the New York Times bestselling author of the Obamacare Survival Guide. Nick, great to talk to you, and appropriately enough, we're going to talk about the #1 health story or breakthrough of this year, Ebola, and now we have a day of PEG to talk about.
Well, you know, this was the big health story. If we're looking at top health stories of the year, Ebola, the Ebola outbreak was. And part of that story, of course, was whether or not the CDC handled or mishandled the situation from the beginning. Were we aggressive enough? Were we doing enough to watch at hospitals and in airports? And, you know, it seems that over time, the CDC has been kind of learning on the fly. This is the latest example that maybe there were some missteps early on. Continues to be a big story. My guess is 2015. It will also be one of the big stories of the year.
So how do you make a mistake like this at the CDC?
Well, you know, that's really the good question, and that's why they're looking into it. They're trained to handle these kinds of very dangerous, high-level microbes, and the question is, how could they have not treated this with the highest level of concern? So that's what they're looking into. I suspect that it'll be a long investigation, and I'm wondering how clear they'll be and how candid they'll be about what the problems were.
You got to wonder how many more of these mishaps Dr. Thomas Frieden can take at the CDC. He's been criticized for the anthrax and the other issues, we'll just call it that, before. Now there's this, especially after Ebola has been so widely talked about. It should be top of mind for every lab technician in the CDC to use the utmost precaution.
You would think. One good piece of information here, one good piece of news is that the Ebola crisis in many ways really revealed the vulnerabilities of the U.S., both the healthcare system, the public health system, and our regulatory system for keeping us safe. Let's hope we learn some lessons that can keep us safer in the years ahead.
Do you think this incident will change things then within the CDC?
It depends on how much attention Congress brings to it, depends on how much attention the media bring to it, whether it's another thing that's kind of swept up under the rug or really made a big priority remains to be seen. Let's hope that they pay close attention to it.
All right, another big, huge story here, and for many different reasons, it was the Ice Bucket Challenge. And it took on a life of its own here. The video is going viral. I think one of the most watched videos this year on YouTube was President George W. Bush doing the Ice Bucket Challenge. That's
right. It's interesting. The two of the top health stories were viral in a manner of speaking, the Ebola virus and the Ice Bucket Challenge that went viral. Yeah, W's pouring ice water on his head was probably one of the most visibly watched. If you look at Google searches, those two stories were 2 of the 5 most searched topics, but it wasn't just important from a kind of publicity perspective. This was a campaign to raise awareness about Lou Gehrig's disease, and in fact, thousands, if not tens of thousands of individuals followed suit with this challenge, raising about $50 million for the ALS Association. And it just happens that this year there was also a significant break in stem cell research involving what causes Lou Gehrig's disease that may in fact lead to better treatments.
I heard an interview with where this all started. I think his name is Pete Frates, and I'm not exactly sure if that's the correct pronunciation, but he was a baseball player at Boston College, and he was the inspiration for all this.
That's right.
And he was talking about the fact that when Lou Gehrig was diagnosed with this disease, there really has not been a lot of advancement since then, and this was back in the 1940s, and here he was with the same disease, going to die the same way, unfortunately, but there has been a lot more money raised because of this this year.
He wasn't the first one to do it, but he was the one who really made it visible, and he challenged, you know, Tom Brady and other people to do it. The idea is donate to Alzheimer's or ALS research or pour a bucket of ice on your head, and it obviously caught on. Lots of people followed suit.
Nick, what kind of medical advances do you think we're going to see like this in 2015?
Well, I think we're going to see more of the work that we've seen in stem cells. There were the other big story of the year was there have been some pretty significant stem cell advancements. There have been some medical technology advancements, and I was going to mention too that there was also a big break in heart disease this year. Just last week, the FDA approved a new test that will indicate whether you are at risk for heart attack. And this is important because for a lot of people, they say both the first and the last symptom of heart disease is a heart attack. It comes without warning, so this is a test that will alert you ahead of time. That's likely to lead to major changes in how this is treated. There was another break in heart disease. Australian surgeons, it's the fourth story on our list of top health stories for the year. They were able to take essentially dead hearts that had stopped beating and transplant them into patients. Up until this point, you could only transplant a live beating heart from a patient who was, say, brain dead into a transplant patient. Now they've been able to take hearts that had stopped beating for up to 20 minutes, put them in a little device, they called it a heart in a box. They revive them, sounds like, Frankenheart, something out of, Mary Shelley's Frankenstein, get it to beat again, and then implant that heart that had stopped beating into a patient, and they are able to live and do well. That could revolutionize heart transplants in this country. About 4,000 people a year die waiting for a heart transplant, and so this could make a huge difference. I think we'll see major changes in the next year there, too.
All right, so perhaps some more advancements in that arena coming up in the year ahead. But one thing I think a lot of fat is actually a good thing right now.
That's right. This was a watershed year for changes in food and dietary guidelines. Now, for decades, we've been told that the best way to avoid being fat is to avoid eating fat. But in fact, the latest research shows, and there's a bunch of it that came out this year, that low-fat diets are actually not better for you. In fact, it is a diet that is closer to the Mediterranean-style diet, which is not a low-fat diet. In fact, it's high in many fats, but there are healthy fats that you have to have in your diet. This isn't a license to go out and eat, Krispy Kremes and garbage up on French fries, but healthy fats in nuts, in fish, in certain cuts of beef, for instance, and even the fats that are in dairy products, butter and cheese. The comparisons of people eating a Mediterranean-style diet, which is a higher fat diet, to people on low-fat diets finds that those who are on the Mediterranean diet have a lower risk for heart disease. So I think we're going to see more work on that, too.
Well, at least for the next couple of days, I'm going to choose to believe that the fat in bacon is one of those good fats.
And gravy, and turkey, and all the rest.
And ice cream, and pie, and cake, because there's still plenty left.
There are psychological benefits
That's
to
right.
those, that are important, too.
Psychological benefits. All right, before we go, though, we want to mention the book real quick one more time, the Obamacare Survival Guide. And make sure you take the National Medicare Survey. Tell Congress what you think about recent changes to Medicare.
Police in New York remain on high alert today. This as the NYPD prepares to say goodbye to a couple of fallen officers. Authorities arrested 7 people for making threats against police, either through social media or via phone. The crackdown comes after 2 officers were ambushed and killed last week in Brooklyn. And Sony Pictures releases its controversial comedy, The Interview. The movie is available for rent or purchase online and is screening at about 300 independent theaters across the country. Moviegoers are giving it mixed reviews. And former President George H.W. Bush remains in Houston Hospital today. He was hospitalized after experiencing shortness of breath earlier this week. The spokesman for the 90-year-old says Bush is in great spirits. A nasty weather storm could spell trouble for people in the Rockies all the way down the Midwest. I'm Francesca Page. We'll have another news update for you in 30 minutes.